Now, why is this so important? Well, by knowing which sub-areas are performing good and which ones are performing below average or below an established benchmark, local managers can make informed decisions on how to allocate resources. For those sub-areas with good performance, program managers will be able to maintain project activities at the current level of operations and to identify the staff working in those good performance sub-areas so they can help others improve their performance, particularly those working in the sub-areas that are below the average coverage or below an expected benchmark. Conversely, for those sub-areas where performance is below average or below an established benchmark, program managers will have enough information to further investigate the reasons for program problems in these sub-areas and to develop some targeted solutions. This is the power of LQAS, to be able to flag areas at the local level, enabling local managers to make informed decisions that will affect the performance in these sub-areas. In other words, using available data from LQAS for informed decision making. At the same time, LQAS will provide enough data to measure results for the entire catchment area, which is primarily suitable for reporting purposes. In a few slides later, we will see how data collected using LQAS can also be used for evaluation and reporting purposes. There are multiple advantages for local program management from using LQAS, but we would like to summarize some key advantages for you. First, the LQAS methodology can be used at a local level with a modest amount of supervision and, more importantly, empowering local supervisors. By identifying sub-areas within our entire catchment area, the project will be able to use a small sample size within these sub-areas in order to assess performance and quality of services. Second, LQAS allows us to identify where the successes and challenges are located so local managers can make informed decisions on how to better allocate limited resources. Third, LQAS produces information that can be fairly quickly interpreted by local managers, thus enabling them to make timely programmatic decisions. In addition, analysis of LQAS data can be done either with traditional paper and pencil as well as with use of computer programs like EpiInfo. However, the advantage of using paper and pencil is to be able to analyze collected data in a simple way and thus empowering local supervisors to take an active role in the analysis of data collected through LQAS while producing fairly quickly information for local managers without the need to wait for computerized analysis that usually take a great amount of time. Furthermore, LQAS provides enough information to estimate coverage for the entire program area as well. This is usually done for reporting purposes. Finally, despite the fact that LQAS uses a small sample size, usually 19 per supervision area, its sampling theory is rigorous enough to produce statistically significant results when implemented correctly. LQAS uses the binomial distribution as the background for its development and applications. As this lecture intends to highlight the basic principles of LQAS, we will address the statistical theory behind LQAS in a separate session outside the LQAS online series for those interested in the statistical background behind LQAS. In the context of child development projects, LQAS can help us to measure coverage of services as well as quality of services. In measuring coverage rates for specific project indicators, LQAS can be used primarily at baseline assessments to assess the health status of mothers and young children in your target area before project activities get started. and to monitor project activities at any given point during the life of the project so we could find out if the strategy adopted by the project is working towards achieving the objectives. LQAS can also be used for final evaluations to assess whether or not project activities have been achieved by measuring target benchmarks at the end of the project. As for measuring quality, LQAS can be used to measure the quality of services provided by the project either at the community and household level or at the facility level. Examples of measuring quality of services include assessing immunization services, growth monitoring and promotion campaigns, nutritional counseling to mothers and caregivers, diarrhea case management, family planning service delivery skills, antiretroviral therapy services, or services provided to orphans and vulnerable children in domains like nutrition, health, or psychosocial support, to name just a few. So what do we need to do to start using LQAS? There are mainly 5 specific steps to follow when applying LQAS in your projects. First and foremost, you need to select the intervention or services to assess within the project catchment area and identify in advance the indicators you want to use for assessing these selected services. Second, you need to define the number of supervision areas, those sub-areas that take the role of management units that will help you better supervise project activities. Third, you need to define the communities within supervision areas that will be part of the LQAS analysis. Fourth, you need to define benchmarks that will let you decide which sub-areas are priority areas and which ones are adequate. We will see that for the purpose of baseline assessments, this is not necessary to define in advance. This type of assessments will generate themselves an average coverage for the entire catchment area that will serve to identify which sub-areas are priority areas, those at high risk because they are below the average, and which sub-areas are adequate ones. And lastly, the need to establish an acceptable level of error, as we will take a sample of our population universe when conducting a quantitative survey using LQAS. Going back to our example in a typical child survival project, we would select 19 observations from mother of children under 2 years of age in each supervision area. Generally speaking, depending on the size of the community, we would need to interview 1 to 3 mothers of young children in the selected communities that we would sample. In lecture number 2, we will address this issue in more detail as we will talk about how to collect data using LQAS. Once data is collected, LQAS uses 3 pieces of information to assess the performance of sub-areas based on the data collected. The 3 pieces of information are the sample size, usually 19 per supervision area, the coverage benchmark or average coverage if we are doing a baseline assessment, and a decision rule. Before we get further on this LQAS table for decision rules, let us define some LQAS key concepts.